Good morning, Dr. Gary on the road, calling you. Dental practices for sale nationwide. We're one of the only, I think we're the only ones that have CPA accountants on staff. And I'm a dentist myself. 25 years I was a dentist. We're now doing this 11 years. So today's topic is when buyers cannot make up their mind about which practice to buy. This is an interesting topic, and we'll get into this. I had a case study this morning, and I'll go over it with you. Our website is dentalpracticeguide.com. Our phone number is 201-663-0935. If you have any questions, if you're a seller, buyer, whatever, mostly sellers, just call us. Let's talk about it, what issues you have, when do you think you should sell the practice. You want a free appraisal of your practice, call us. You just want to chat, give us a ring. We do this 363 days a year. We take off Christmas and Easter. The information you're about to hear is for entertainment purposes only. So just give us a call, 201-663-0935. It is getting sunny here in New Jersey. I need my glasses again, excuse me. So anyway, today's topic is when buyers simply can't make up their mind. We got a case study going on. We have one buyer that's been out 9 years, has been practicing, had some great jobs, making a fair amount of money, but has never owned their own practice. They've always wanted to own their own practice, but they never have up until now. They've bounced around. Here's what happens to these people. They work for somebody so long, they get in their comfort zone of making a fair amount of money with no aggravation. When you work for the DSOs, for example, and they provide a nice environment. They're giving you health insurance, dental insurance, eye exams, 401k. You know, they're being very reasonable to you. Then they provide a nice working environment. But if you're a dentist, ultimately you want to be on your own. You want to break away, and you don't want to work for anybody else. The longer you wait to buy your own practice, the more challenging it's going to be. Because now you get into a rut of working for somebody else, not having the responsibilities. And then you start to worry you may not be successful. Let's take the success thing out of the equation. You will be successful. I don't even want to hear it, that you don't know what the transition's going to be. Statistical case in point, 99.75% of all the dental offices sold through Bank of America were successful. 99.75%. Everybody was able to pay their monthly note. The ones that didn't, drugs, alcohol, or they go try to set up an office in Scottsdale, Arizona, they're going to be cosmetic dentistry of the world with no planning. Or they fire everybody in the staff and change all the marketing, and you're just going to screw up everything. It's so, you know, it's crazy. That's what fails. But very, very few people do. And you're never going to find the perfect practice. I've talked about this on other tapes before, but I've got to bring this up again because nobody listens. You cannot find, you will not find, it's out there, but you're never going to find it. It doesn't mean you should stop trying, by no means. By no means. But you should still pick up a practice and then continue to look for your ideal practice. Or work also part-time your present job, pick up the other practice, work there part-time. Maybe the owner will stay on a little bit, or the seller, get on it. But forget looking for the perfect practice. Statistical probability, it's just not going to happen. It's so hard. Give yourself some freedom. So what you're going to have to do is understand that the longer you're out, as I've mentioned before, the more difficult it will be to buy. All right? Because you can't find a perfect practice, keep saying that to yourself. You now be able to buy the right practice for you. You always want 5 chairs. You can't get 5 chairs, you see you can't function. Well, that's nonsense. You can work on 4 chairs, and you can even 3 chairs sometimes. Manipulate the hours a little bit in the dental office, so maybe they can start before you get there and then continue after you leave. Those are some of the things. And then you go in and you look at the equipment, you critique the equipment. Well, he's working or she's working, that seller doctor's working on that equipment for all these years. Certainly you could work for a few months and not have to worry about it. And then do all your changes, because it's not until you live into a place or work at an office that you'll know you want to change. But there's a reason for all these things that these buyers cannot get off. They can't get off the bench and make a decision. Now, a lot of them also have fear. That's a little different now, too. They have fear based on this significant amount of student loans, $400,000, $500,000, $600,000 student loans. They have fear they can't pay them back. That's why they don't want to leave their present job. But you know, if you want to cross a canyon in 2 leaps, you can't do it in 2 leaps. You have to do it in 1 leap. Boom. 1 leap to cross a big area. And that's what you've got to do with these dental practice purchases. Just get on it. Do your research, get the right dental attorney, get the right dental accountant, and you're going to get close to the perfect practice. You probably won't be able to find the perfect one, at least not initially, but you can get pretty close, and that's what I think you should be doing. All right, concentrate your time on that, and you will be very successful. All right? Don't keep dwelling over yesterday. Move forward from today on. All right, that's it. Dr. Gary signing off. We had a great day in New Jersey. I'm going bike ride now for a little bit and then back to work. So great seeing you, team, and talk to you soon. Bye.